Hello friends, myself Dr. Varun Rishi, MD Homeopathy, has been in the system of homeopathy for last 20 years. Today we are going to share something about thyroid problems. People are nowadays suffering from this problem quite oftenly. Previously it is the ladies who used to suffer this problem quite oftenly, but nowadays even the men are suffering equally. Now we are going to share about the thyroid problems and what is thyroid and what causes it to suffer most. Thyroid is basically a butterfly shaped gland which is situated in front of neck and weighing just 25 gram in adults. Even in spite of it so small in size, it is a very valuable gland which is responsible for maintaining different organs and even each and every cell of the body. From simple metabolism to you can name any system which gets affected with thyroid. It could be central nervous system, respiratory system, digestive system, or even the reproductive systems. Let us now come to the clinical presentation of thyroid. It is well known affair that people come to know about this thyroid only when they begin to gain weight suddenly. So weight gain is the most prevalent symptom, which is the first sign which shows the patient is suffering from thyroid problem. Other things are because it is a water retention disease which lowers your metabolic rate, so is the reason why a patient begins to gain weight. Number two thing is patient begins to feel weakness, tiredness, dullness, lethargicness, and other systems which get affected under this influences begin to develop symptoms accordingly. Like in females, it is the weight gain, mood swings, depressions, menstrual abnormalities, sometimes profuse bleeding, sometimes scanty bleeding, and so on. Similarly, the psychiatric symptoms like depression and mood swings. Now, what are the causes which affects your thyroid? The most prevalent cause worldwide is the deficiency of iodine, and the other prevalent features which are the causative factor responsive for thyroid problems are infections. It could be bacterial or viral. That can lead to thyrotoxicosis or the inflammation of the thyroid glands, leading to abnormal secretions of thyroid. Depending upon if it is the increased concentration of thyroid hormones, that can lead to hyperthyroidism. But if the level of secretions gets diminished, then that can lead to hypothyroidism. Today we are going to discuss more about the hypothyroidism. Let us come to the clinical presentation of hypothyroidism first. First sign that comes into play is people begin to experience sudden gain of weight, especially 5 to 7 kg of weight gain in last 2-3 months. Because it is a water retention disease, patient who tends to feel in the form of constipation, dullness, weakness, tiredness, fatigueness, and depending upon the other organs or other systems, patient experiences symptoms accordingly. It could be dysmenorrhea, painful menstruation, irregular menstruation, profuse bleeding, or even the scanty bleeding. Depending upon the skin, it could lead to simple dermatitis, to eczema, psoriasis, and even vitiligo. That is the pigmentation or the discoloration of the skin. Even blemishes is once again can be a part of thyroid problem. Now come the clinical presentation. Now come the treatment part of thyroid. Well, unlike allopathy, wherein thyroxine and allotoxin are the commonly used medicines to control thyroid problems, but where in homeopathy we have more than 70 medicines which can be given to check thyroid problems. So it is the clinical presentation as well as the susceptibility and the sensitivity of the patient, wherein we will have to cover the overall constitution of the patient. That is the genetic characters, predisposing factors, and the susceptibility and the sensitivity of the patient, which is to be taken into mind to prescribe the medicine. Now, the problem arises when the common man comes into play while prescribing homeopathy medicine or while treating thyroid through homeopathy. A common man tends to interfere by self-medication, because people are quite very smart nowadays and they are quite familiar with the homeopathy medicines, and they tend to attain some information through books, references of books, or through even Google, and they tends to prescribe medicines accordingly just to palliate the most superficial symptoms, to be keeping in mind that they are going to treat the patient of thyroid. Let us take an example of, come to the common symptoms of thyroid. That is a weight gain, obesity, feeling of tiredness, weakness, and fatigueness. These are the common symptoms of thyroid as well as the common symptoms of some other ailments like iron deficiency, where the patient experiences the same kind of dullness, fatigueness, over-irritability and tiredness. The second thing is it could be a part of simple iron deficiency or pernicious anemia, wherein the intrinsic factor is lagging and patient is unable to absorb the B complex from the gut. So we will have to understand the underlying cause of the disease before prescribing any medicines. And common man who does not have the fundamental knowledge of any system is basically in a habit of doing that kind of mistakes again and again. And they do try to combat or they do try to cover the most superficial symptoms. Let us take an example of with a patient who comes to you for a kind of distension in the abdomen or fermentation or bloatedness in the abdomen with eructations. He immediately prescribe you medicines of Carbovec. If he has distension the whole abdomen, he will prescribe you medicine China. That is just to check the superficial symptoms. Even the patents are available in the market in the form of some branded companies. It could be SBL, it could be Schwabe, or it could be Recweg. Patents are there having the complex medicines to check these symptoms. So these medicines are basically meant to check the acute manifestation but not to cure the medicines. So there is a main problem wherein people have to understand you will have to take the help of professionals who have spent more than 20 years 10 years in their professional life and more than 20 years in their clinical experience to treat such type of patients. So the main objective is to make people aware of these things, because these things are required to get patient free of these symptoms. Anybody, or you can say a common man, very simple to say these things, that the section 498 or 498 is the cause of dowry death, but he cannot become a liar just by knowing the section of these things, and he cannot fight his case in front of judiciary because he does not have the fundamental knowledge of tackling that kind of case. So my main objective is to let people aware of thyroid, its complications and the line of treatment that is required under the most skilled and professional ones. So always be in the safe hand of homeopathy through good professionals. Thank you very much for watching this video. Thank you.